let's talk about this right now, and let's talk about heart health. Mike Parry, you're a walking miracle. The cardiologist is in the house. The doctor will see you now.
Well, it's fantastic. Thank you very much indeed. And we had a short chat, actually, before I came on. Doc, you talk about statins and all that. I'll tell you some of the drugs I take to keep my heart in place. Carvedilol, allopurinol, digoxin, avostatin, and recently a very new one which treats both heart disease and diabetes too, which I've also got. You know, I'm a walking disaster. They've kept me alive for the last 20 years. So which of those would you recommend and which wouldn't? And my history, by the way, Doc, is that I was in Harefield Hospital, where I believe you did some of your training. Harefield Hospital, one of the top, cardiological centres in this country and possibly the world. And after waiting something like 4.5 months for a heart transplant, I couldn't wait any longer. My life was disappearing, my career was disappearing, so I left. And I was told that, you know, my chances of survival wouldn't be that good. But I devised my own method of getting better by simply going through exercise. And to this day, I walk 30 miles a week to keep my heart in shape. And I've survived for something like 20 years. That was 2004.
That's amazing. Of course, Mike, there is a good advert for the right medication, I guess, Asim.
Yeah, no, it's an extraordinary story and really well done to you. I mean, it's inspiring. And it reminds me, actually, of one of my most interesting patients. I've written about him, so, you know, I can give his name. I've written publicly about him. So I saw this chap several years ago. He was a Virgin Atlantic airline pilot, early 50s, and suffered a heart attack, could no longer fly. Luckily, it wasn't mid-flight. But he was well into his, exercise. He was running marathons, but he wasn't eating well. He was overweight. Anyway, he started doing his own research. He was, by background, also a maths and physics teacher, so, you know, pretty smart bloke, and started looking into all the drugs he was prescribed. He was put on a cocktail of drugs after his heart attack, which we normally do, and then started getting side effects, started feeling miserable, started reading the data himself about the individual drugs and how beneficial they were for him, and realizing there was only a small benefit. And then he gradually decided to basically come off all his pills. 5 years later, he's off all his pills. He's breaking his own records in ultramarathons. He changed his diet. He actually decided to go on a ketogenic diet, and that worked really well for him. He lost weight. All his markers are fantastic. And in fact, we did some further imaging on his heart, and it suggests that not only was there no progression in some what we call bystander disease that was picked up the first time, but there's potential reversal. And, I think what's really important is that patients are just fully informed and empowered about what the drugs are doing. And often they're quite surprised when they're told, for example, that a drug that has been blindly prescribed saying you must take this drug. They're quite surprised when somebody else comes along and actually says, well, actually, just so you know, this drug, the chances of this drug benefiting you in terms of, preventing another heart attack or whatever else is about 1 in 100. Now, a lot of patients may decide they want to carry on taking the pill, but many of them say, well, hold on a minute, doc, that doesn't sound very good odds, I don't want to take it. And that's actually when we talk about ethical, evidence-based medical practice, that's at the heart of it, transparent communication of risk and empowering patients. I think from what you've told me, I'm sure the drugs have definitely given you some benefit, but it sounds like, mind over matter, you exercising and doing all those other things, I'm sure must have had a massive impact.
Yeah, and curry night at Wetherspoons on a Thursday has helped, hasn't it, Mike?
Yeah, it does. But Doc, actually, funny what you say, I suffer from dilated cardiomyopathy, OK? And I think I'm right in saying that means that the left-hand side of your heart just gets too big, too swollen, and it can't pump the blood around your body properly. When I left and said I don't want a heart transplant, when I started walking 30 miles a week, I went back and saw my doctors. Dr. Nicholas Banner was my cardiologist at Harefield, and I think you've worked with him.
Worked with Nick Banner.
He was amazed that my heart came back in. Wow. Normally speaking, I think I'm right in saying that whilst your liver can recover if you stop drinking, and your brain can recover if you've had, a concussion, your heart doesn't normally repair itself, but mine started repairing itself. Is that remarkable?
Yeah, I mean, it can actually happen. Were you a heavy drinker
I'm sorry?
Were you a heavy drinker?
That's quite an awkward question. I would actually ask you a lawyer to answer that one, Mike Parry.
No, I'll be absolutely honest. I was a very heavy social drinker.
Yeah.
I worked in journalism and broadcasting, and we finished work at 10:30 in the morning, and we were probably in the pub till 4:30 in the afternoon. In those 7 months that I was in Harefield, not only did I forsake alcohol, as Tommy Shelby said in the Peaky Blinders, but also I lost about 4.5 stone in weight. And
listen, you hit the nail on the head. So alcohol in excess can actually be directly toxic to the myocardium, to the heart muscle. But, and I've managed many, many patients like this, when they stop drinking, a significant proportion of them will find their heart muscle, the dilated heart actually reduces in size and starts pumping better. So I suspect you're actually, from what you said to me, it sounds like what you did with your lifestyle has probably had the biggest impact.
Well, honestly, Mike, you know that I'm your #1 fan. I'm such an admirer of you as a person and your career, and I'm so happy that you've survived against the odds. And now, look at you, the picture of health. Let's talk, if we can, Mike, Francine, Albie, and of course, Asim, about the vaccine. Can we have that conversation? I'm very pro-vaccine. I'm triple vaxxed. I'm delighted that it has arrived. It clearly is identified with the reduction of severe illness and death. I'm happy to debate that, but that seems to be the thrust of it. But Asim, in my view, many proportions of the population just don't require it. What's your view?
Yeah, it's a great question. I think that's what the debate that's been ongoing is. Just like with lockdowns, there's been this whole issue. We should have protected the vulnerable. Did we need to lock down everybody? And we didn't. We failed to protect the vulnerable, and many people died. I think a similar question needs to be asked about the vaccine. I think we know that the people most vulnerable from dying from COVID were elderly, frail people. And you're right. I think the data does show, certainly from prevention of serious illness and death from COVID, the data is in the direction of the vaccine helping prevent that. Having said that, the original randomized controlled trial from Pfizer, that 6-month trial didn't show any significant reduction in death or from COVID death. So it's a little bit, there's a bit of a discrepancy there, but doesn't mean to say that the vaccine hasn't had a benefit. So I think...
and that's where, if you're in a vulnerable group, based upon what you were saying earlier about evidence-based medicine, you're like, look, you're 78, you're very overweight, you've got asthma, probably worth giving that vaccine.
Absolutely. I think the only problem, Mark, with this, and this is what's going to unfold over the next several months, is that the raw data on the trial, and when specifically about harms, was not available, and it started to be released. It's going to probably take several months before we get all of that data to try and look at the potential harms, and then we'll be able to have a more informed discussion about whether, to what degree, who's going to benefit most from the vaccine and who is more likely to be harmed. That's something that we always, with every drug that we use in medicine, we have to think about. Just on an extreme level, just for people to understand this, if you've got, say, a type 1 diabetic who's, got very high blood glucose, is very sick, insulin, a certain dose of insulin is going to save that person's life. If they don't get it, they're going to die. If you gave that same dose of insulin, Mark, to a healthy person, it would kill them. So we have to think a little bit more in a nuanced way about understanding where the benefit and risks
You're
are.
the doctor. I don't understand why people are being pressurised into having a vaccine if they're not in a group that's risking death or severe illness. I don't understand why. Well, can you help me with that?
Yeah,
I'm not a medic.
So I think things have evolved, and I've also got to declare, Mark, I had the vaccine as well at the very beginning. I was one of the earliest people to have it because I helped in a vaccine centre. And I did it not because I felt I was at particular risk. I was able to assess that my risk from serious illness and death from COVID is very, very low. Was because at the time, and I think most people felt that was the case, like with other vaccines, it would prevent me passing it on to vulnerable people, and that was for me a reasonable reason to take it. Now the situation has evolved. We've got more information, more data. Certainly with Omicron, it suggests it doesn't prevent any infection. So the only it doesn't prevent. It doesn't prevent infection. It may prevent serious illness and death, but it doesn't certainly prevent transmission. Then it becomes an individual choice. Like with statins. Is this, am I having this information on the drug explained to me properly, and then I'm making a choice? So the mandates issue for me was very, very bizarre. It didn't make any sense. And my own interpretation of the mandates were the only people to benefit from the mandates were the drug industry. from my perspective. The only people that benefit from mandate.
Calling a spade, is that what's driving this desire to get every man, woman and child vaccinated, including against the advice of the JCVI in relation to 12 to 15-year-olds? Is it back to that conversation about big pharma and making money rather than public health?
Listen, I think it's a legitimate question. And I think given the history, what we've talked about already, the history of pharma, these are companies, many of these companies, without singling out one particular company, have been found guilty of criminal activities between 2009 2014. Most of the major pharmaceutical companies paid fines totaling about $13 billion for hiding data on harms, misleading doctors. The BMJ wrote an editorial on this, and they said few changes in the system have occurred to stop these problems happening again. So there's a crisis of trust. There's a legitimate crisis of trust, and therefore, getting access to all the data to understand what's going on, to explain what the true harms are really important. And of course, this vaccine was rolled out under emergency use authorization. Traditional vaccines, I'm a huge fan of vaccines. I mean, vaccines are estimated to save about 6 million lives a year. We're talking about whether it's MMR or polio, smallpox, all of those vaccines have been truly remarkable achievements in modern medicine. But, most of those vaccines took at least 10 years to be developed for safety checks. We haven't had the time. Now, I understand why we're in this pandemic crisis.
But that's why you can't mandate
Absolutely.
For people, especially, well, you shouldn't mandate for anyone, should you? Because it creates vaccine hesitancy. And also, it just goes against that Hippocratic oath.
Yeah, we don't mandate the other vaccines. We haven't traditionally mandated for the whole population for the other vaccines. So it's through persuasion.
Against the diseases that kill many people.
Absolutely.
Of all age groups. So, I mean, do you feel you've covered that? Because my last question to you, you are a cardiologist. I want to ask you, on the internet, are they just conspiracy theorists? People talking about, sports stars, footballers, people in stadia collapsing all the time, having heart attacks. Are we putting 2 and 2 together and coming up with 5? Shane Warne, what a sporting legend he is, dies at the age of 55 from a massive heart attack. What do we do with stories like that?
Yeah, on the Shane Warne issue, Mark, I mean, for me, it's affected many people. For me personally, he was one of my greatest sporting heroes. At one stage in my life, I had to make a decision between pursuing a career in cricket or medicine. I played quite a high level. I was actually inspired by Shane Warne to become a leg spinner. I was a successful leg spinner. Wow. I was gutted when I heard that news, absolutely gutted. And, the first thing as a cardiologist, you try and look at, well, hold on a minute, what are the risk factors here? This is my area of expertise, coronary artery disease. They said he had a sudden cardiac death from a heart attack. I was reading an interview by one of his close friends just the other day, and he said, and if this is correct, he had no risk factors. This is a mystery. What happened here? Now, of course, on the internet, people have asked the question, is Shane Warne's death in any way linked to the vaccine? Well, first of all, we know he had the vaccine. We also know he had COVID about 6 months ago, and he was quite sick with COVID. Now, COVID has also been linked to heart attacks, but usually the COVID situation, which you knew about, is in the acute phase, when people are in hospital. To be honest, any infection can trigger a heart attack. Pneumonia, body's under stress, it can trigger a heart attack with someone who's already got underlying heart disease. So that's something I've managed, that's well known. 6 months later, I think it's much less likely. He would have had heart scans, that kind of thing. And the question then is there any link between the vaccine and cardiac arrest? And unfortunately, there does seem to be a link. We don't know how strong that link is because Pfizer's own documents released recently on possible side effects, cardiac arrest was one of them. The original New England Journal of Medicine clinical trial, and I looked at the supplementary appendix in there, there were 4 cardiac arrests in the vaccine group and 1 in the placebo. Now, still small numbers in absolute terms, but if this is a genuine signal, then I think it would be naive, and as a cardiologist, I've got to be honest, I think that, people need to, well, I think that the vaccine may well have played a role. It certainly has to be part of the differential diagnosis in Shane Warne's death, and if that's the case, that's tragic.
Doc, sorry, Mark, may I just come in there?
Very briefly, Mike, we've only got a couple of seconds. Go for it.
Doc, also, Shane Warne had been on a 14-day liquid-only diet, hadn't he? Doesn't that also affect the, the function of the heart?
Yeah, it's unlikely, to be honest. I think people do crash dieting all the time. I mean, it's something I've researched as well, looked into. So crash dieting up and down over many, many years can increase risks. But he didn't have any risk factors, so he wasn't a diabetic as far as we know. He didn't have high blood pressure. If the liquid diet itself was causing a problem, it would have come out.
Well, look, I think it's very